everybody, welcome back to Tuesday Tips. I am Dana, and this is part 2 in my mini-series on emergency and disaster response volunteering. I am very pleased and excited to welcome my friend and colleague, Jared McCannell, to talk about more formal training that you as a leader of volunteers and perhaps your agency or the volunteers that you work with can be involved in more formal disaster and emergency response efforts. So take it away, Jared.
Hey folks, Jared McCannell here. Today I want to talk a little bit about volunteer management during a disaster. Now, the current pandemic has kind of thrown a wrench into most of our volunteer management practices, at least the typical ones we're used to. However, it's also given us an opportunity to reevaluate how volunteers fit into a disaster response. In this case, our current public health crisis, the COVID-19 pandemic. Now, of course, there are many great opportunities for volunteers during a public health crisis. However, many folks that are qualified, doctors and nurses and other certified healthcare professionals, get turned away because they're not pre-qualified or pre-registered to be a volunteer. So they're not technically part of the official response, which makes them a liability. These volunteers are often called spontaneous unaffiliated volunteers, or SUVs. And this can become a major problem because folks that want to help out, that have the best intentions or maybe the best qualifications, if they're not part of the official response, they can become part of the disaster themselves. They can become victims while trying to help victims. And that's frustrating for emergency management professionals who have limited resources during a crisis and then have to distribute those resources to help other folks that weren't originally part of the disaster. So that's very frustrating. Emergency managers really don't want folks to self-deploy, and there are a number of ways folks can plan ahead to be involved, depending on your interests, your qualifications, your availability. For instance, during a public health crisis, there are organizations or groups, for instance, the Medical Reserve Corps. Each state has a number of units, Medical Reserve Corps units, which are community-based. They're healthcare professionals that register ahead of time, sign up ahead of time. They drill and practice with the emergency management agency in the area or at the state level. And they practice things like vaccine distribution, so on and so forth. Now, these volunteers often are retired healthcare professionals that still have an active license, or maybe they don't have an active license, but they have the skills and they can be credentialed. In an emergency situation, you can get an emergency credential. However, you have to be pre-registered for any of that to take effect. States also have a state registry for volunteers called the Emergency System for Advanced Registration of Volunteer Health Professionals. It's a mouthful. The acronym is ESAR-VHP, which is also a mouthful. However, the idea with ESAR-VHP is that each state should have a registry of healthcare professionals with certain designations. They know that they're going to need so many doctors, so many nurses with different qualifications, different backgrounds. And if they're registered ahead of time, the state will be able to access those folks. However, as volunteer coordinators, you all know that just because you have a robust list of volunteers doesn't mean you have an engaged volunteer population. And so with that in mind, things like the Medical Reserve Corps can become outlets for those state registries where folks can get involved and drill and practice, exercise with other responding agencies as well. So although there are these registries, they don't necessarily work as intended. They still need the touch of a volunteer coordinator. So maybe there's an opportunity for some of you out there to get involved at the state level. Now, for other volunteer coordinators, if you're interested in being involved yourself, there are usually volunteer reception centers set up, sometimes virtually, sometimes in person. And often those are staffed by local AmeriCorps members, folks that might be assigned or deployed to your area who are doing a year of service or a couple of years of national service. Part of their expectation is that they will be involved as part of any sort of response, and they train on certain things. One of them is often the Volunteer Reception Center, or VRC. Now, if you're a volunteer management professional, a VRC is a great place for you to be. So contact your emergency management agency and see if they have plans for setting up VRCs and how you can get involved. They might have you go through a certain credentialing process or pre-registration, and that's exactly what they want and what we need. Now, often when I get asked about public health emergency response, there are kind of two questions that come up regarding the pandemic in particular. What options exist for volunteers during a pandemic? And then how do we go about leveraging our volunteers if we want to get involved at our agency? So, if your operations are on hold because of the pandemic and you have a huge pool of volunteers, maybe there is a spot for you in your agency to be involved. So to answer the first question, what options exist during a pandemic? Contact tracing, vaccine distribution, other health and human services needs, disaster behavioral health, for instance, or disaster mental health, as the Red Cross calls it. Now, these behavioral health teams are essential at all responses because you have a lot of people who are dealing with grief and loss and trauma, and just about anyone can go through at least a basic amount of training to be involved in that process. So if you're interested in behavioral health, you can certainly reach out to your state and ask if there is a disaster behavioral health team or a DBH team, or reach out to your local Red Cross chapter and ask if there's a disaster mental health program that you can get involved with. And of course, there are VOADs, which are voluntary organizations active in disaster. And these are pre-identified organizations like the Red Cross or the Salvation Army, which have a designated role. Often they'll specialize in something. For instance, the Salvation Army does a great job with large-scale feeding. If there's a disaster and they need to get food to victims or even responders, the Salvation Army has the resources to do that. And in many communities, they're the first ones that'll be involved in that aspect of the response and recovery. And of course, there are tons of other agencies involved in VOADs, and yours could be too. So if you're interested in leveraging your volunteers during a disaster, contact your state VOAD or regional local VOAD. And if you can't find them, reach out to national VOAD, and they can help track down who you need to be speaking to in your community. And of course, the Medical Reserve Corps is a great place for anyone. You don't have to be a healthcare professional. They are also looking for folks that could direct traffic, hand out bottles of water, welcome people, all kinds of aspects of a public health response that are non-clinical. So in summary, the one thing you need to take away from this is please do not self-deploy. Don't be an SUV. Don't be part of the disaster. You want to be part of the solution. So find a way to pre-register in your area of expertise, whether that's healthcare or public health response. If it's an unaffiliated agency that you work with, find out how you can become an affiliated agency through your VOAD. If your volunteers want to get involved, encourage them to reach out to their local Medical Reserve Corps or VOAD or other response agency that works with volunteers. And then take free FEMA trainings. If you're interested in disaster response and you want to be prepared, there are a ton of FEMA trainings online for free. If you go to the FEMA website, you can look under training and you'll find all kinds of options. And it starts with the Incident Command System, or ICS 100 class. And that basically breaks down the chain of command. It discusses how agencies get involved, who's in charge, what happens, the whole process. And that's really the foundation of our national incident management system. So if you really want to be involved in the most constructive way, find a way to be involved in that chain of command through one of the appropriate agencies, pre-register as a volunteer, and be patient. When your emergency management agencies are responding, they usually have very limited time and resources. So please think of all this before the disaster strikes. Okay, thanks again for listening. This is Jared McCannell signing off. Take care.